Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
I'm Jeffrey Hayes, and it's National Nutrition Month. Today, we're talking about nutrition and fertility with Dr. Ashley Eskew. Dr. Eskew is double board certified in obstetrics and gynecology and reproductive endocrinology and infertility, and is in practice at Atrium Health and also co-founder of OvuLife MD. Dr. Eskew, welcome to ASRM Today.
Thank you so much for having me, Jeffrey. I'm excited to be here.
So I do this with almost all of my first-time guests. I just want to ask, and I'm sure our audience is curious, how did you find yourself in this field?
Yeah, that's a great question. I always love hearing what others have to say about that too. So I actually happened upon it because I was trying to match into an acting internship my fourth year in GYN oncology, actually, and they had no space. So they gave me one in reproductive endocrinology and infertility. So I got to do my AI in that as a fourth year medical student and just had so much fun with it and became enthralled with the field and really just grew to love it. And there was really no looking back after that. So ultimately ended up doing residency where I am now at Atrium Health in Charlotte, North Carolina, and did fellowship at Washington University in St. Louis. And I'm excited to be back in practice here.
So you contribute to nutrition in fertility, and we don't often have a lot of opportunities to discuss that in fertility medicine. Can you enlighten our audience into how has discussing nutrition sort of evolved in fertility medicine as you've been working in it? And maybe if you know some more historical context you can give to it?
Definitely. You know, as I was kind of looking through a lot of the recent research that's been done and kind of what I've accumulated over the years, just the amount of information and studies that have come out on this in the past decade, as opposed to the decade before that, is drastic. I think there's a lot more conversation around this, and in other areas of medicine, I think it's been increasingly recognized over time that the diet has a huge impact on chronic disease states, and oftentimes we think about just like cardiovascular disease or diabetes or something like that. But, increasing evidence has shown it's also associated with fertility and reproductive outcomes as well. And so it's been really great to be able to see that change over the past, 10 to 20 years. And I think a lot of the original data looking at dietary factors that impact fertility and reproductive outcomes was from the Nurses' Health Study. And looking at how those things relate to, things like ovulatory infertility. And then a lot more of the studies that have come out more recently have focused on different populations, different infertility diagnoses as well. I think one of the limitations is that it's, by nature, a lot of observational data, and that there aren't a ton of large, robust randomized controlled trials looking at dietary patterns and as they impact reproductive outcomes, which is something that I think the future holds. But it's been really great to see just an increasing amount of research done over this in the past 10 years too.
How does it tie into a lot of studies about obesity and reproduction? It's actually funny. We're recording this on February the 10th, and today's episode of ASRM Today that came out was a discussion I had with Dr. Christina Boots about obesity and reproduction in a recent committee opinion that had come out. What are some correlations there, or are there any correlations that you have come across?
Yeah, that's a great question. A lot of the studies looking at dietary patterns will ultimately control for BMI. We know that certain dietary patterns are associated with higher body weight and, increased BMI. Traditional Western diet that's a lot of highly processed food, fast foods, that sort of thing tends to have a higher association with that. And we know that BMI is really important for reproductive outcomes as well, as I'm sure Dr. Boots got to discuss with you too. And so a lot of the studies in looking at dietary patterns don't necessarily focus on weight loss or differences in BMIs, for example, but that is an important element to consider.
What are a few good practices that can be suggested for specialists looking to help patients with nutritional questions? Do you feel that it's more or less a referral process normally, or are people becoming more educated where they can sort of have those conversations without having to necessarily do referrals?
Absolutely. I think that there's a role for referrals to registered dietitians, nutritionists, or to, weight loss coaches or physicians and that sort of thing. But in general, whenever I'm speaking with couples about dietary recommendations just to help optimize reproductive outcomes, I focus on the fact that it feels like, there's so much in this journey that's outside of any one person's control, right? And dietary lifestyle factors are something that they can control. And although, everybody wants a quick fix, or maybe it's keto, or maybe maybe it's low carb, or maybe it's low fat, or this, that, and the other. If you look across all the data that's been, accumulated, there are some general patterns that emerge, like I mentioned, and really focusing on eating a high quality diet that's rich in whole foods like fruits and vegetables, whole grains, lower glycemic load type carbohydrates. So ones that won't spike your glucose level and insulin as much, in terms of the quality of fats that you're eating, focusing on anti-inflammatory type fats like omega-3 fats that are found in seafood like fatty fish, like salmon and that sort of thing. Instead of eating a ton of conventional animal meat, maybe incorporating more plant-based proteins as well. And soy has actually been shown to be not harmful when it comes to fertility, which is a source of debate amongst, some studies and a lot of providers too. And then, not only just carbohydrates, protein, the types of fats, but also what are they drinking, right? So focusing on drinking water as your primary beverage, avoiding sugar sweetened beverages, limiting alcohol intake, all of these things add up over time. And also on top of that, really, it's not just about necessarily the types of food that we eat, but then also looking at the environmental contaminants that are found within them. So data from the Earth study, really kind of was one of the first to incorporate some of the elements of environmental factors that also are a part of our food system. And so they found that, couples who ate increased levels of high pesticide residue produce had lower success rates after undergoing IVF with embryo transfer. And so, I tell them, if you can buy organic, then do that. Wash your fruits and vegetables really well. Or, if you can't, focus on getting those lower pesticide residue, burden type produce too. And so it's, and in terms of the quality of meat, that's another thing that comes up in conversation a lot. And they're like, well, what if I get grass-fed, organic meat and that sort of thing? And that certainly has lower of a, environmental toxin burden than a lot of the conventional animal meat does. And the reality is that a lot of studies haven't looked at that. So that's part of something that we're missing. But I think those are some general kind of take-home points that you kind of see across the board there that are easy to kind of just give patients. And, I make that in a simple handout format so they have something to go home with and kind of focus on and can kind of tick off some boxes as they go. So yeah, and the other important findings from the Earth study, which I didn't really mention, that was a prospective study of just over 350 women undergoing IVF, and their primary outcomes were looking at implantation rate, clinical pregnancy rate, live birth rate, miscarriage rate after IVF with embryo transfer. And they looked at a lot of other ART outcomes. But with the pro-fertility diet specifically, the dietary patterns that we were just talking about, they also noted people who had higher adherence to a pro-fertility diet had higher intake of supplemental folic acid, vitamin D, and B12. And I think that's an important thing to mention because we kind of touched on the dietary patterns as well as the role that environmental toxins might play in that. And then also supplements, right? So it's probably more than just one single element that was associated with a significantly higher implantation rate and live birth rate in these women undergoing embryo transfer. But one of the things that I tell my patients is that there's no amount of supplements that can make up for poor dietary choices, right? So I think that all of these things really do complement each other. And also that study looked at different dietary patterns. So beyond just the pro-fertility diet, they looked at the Mediterranean diet, which I think is commonly thought of as the best diet for fertility. And rightfully so in a lot of ways. Multiple studies have shown beneficial effects from a Mediterranean diet, which is also characterized by prioritizing whole foods, leafy greens, fruits and vegetables, seafood sources of proteins, all the things that we talked about. But I think it's important to think about regional differences and dietary patterns there because, data published a couple of years ago, it was published in FNS, of a study of women out of Italy, actually, and looking at their adherence to a Mediterranean diet, didn't see as significant of a benefit with increasing adherence. But that's also similar to what was shown in the Earth study, is that women who had higher adherence above the second quartile really didn't see much more benefit. There was still a significantly higher live birth rate for them. But if you look at a cohort of women in Italy versus the US, their baseline adherence to a Mediterranean type diet is probably already higher. So they might have less to gain by increasing adherence. So I think that that's just important to be mindful of, regionally where you practice and what your patients tend to gravitate towards in terms of their dietary choices. And that should play into your specific counseling to them as well. And so I think that those are important elements to remember. And then you had asked about the impact of BMI on fertility and reproductive outcomes. And I know that you're speaking with Dr. Boots, as you mentioned. And one of the things that I didn't mention when we were talking about where I did training and that sort of thing was that I chose Washington University because their interest in that specific area. Dr. Moley's lab had the, obese mouse model. And then Dr. Emily Youngheim had a study that was going on while I was there called the Lifestyle and Ovarian Reserve Study. And I was fortunate enough to get to participate in that as well, and also work with Dr. Jorge Chavarro on that. And we looked at increasing adherence to a pro-fertility diet compared to other dietary patterns in a Midwestern cohort of women. So we had a couple different ones than they did in the EARTH study. But interestingly, what we found, and actually our paper just got accepted for publication recently, so you'll be able to look out for that, but was that women with overweight or obesity, so specifically women with a higher BMI above 25, who had a higher adherence to a pro-fertility diet, noted a significantly linear association with a higher AMH or anti-Müllerian hormone level, as well as antral follicle count. So whereas traditionally we think increasing BMI is inversely related to markers of ovarian reserve, specifically AMH usually goes lower as BMI increases. Our study showed that even if BMI was higher, if you had a higher adherence to this type of dietary pattern, you had a higher AMH as well. And while this needs to be replicated in other studies, it's still pretty interesting. And you could think about it almost from, hey, could we take this to the point where it could be a preventative effect for women, catch them earlier in their reproductive journey and being able to counsel them on these dietary patterns that often do result in weight loss, but pretty fascinating that also we found some association with markers of ovarian reserve.
Have you found either personally when you're working professionally or maybe in talking with peers? I'm very intrigued by the emergence of the plant-based movement. I was in the grocery store just the other day, and I've been plant-based for about a decade now since I met my wife. Yeah. And I know no one says vegan anymore because that's just if branding has taught us anything, they learned real quick. Don't use the word vegan. It's plant-based. But I was telling my father about it. He was asking me about Beyond Burgers, and I said, well, they actually have an outrageous amount of fat. Like they're not. Just because they were plant-based doesn't mean that they're good for you. Like, you still have to read the labels.
Right. I mean, Oreos are vegan, right? So
Oreos are vegan. That's absolutely correct. So it's Triscuits, things of that nature. There's things you feel sneaking up on you. Have you found that a lot of prospective patients tend to worry maybe too much about, they start freaking out about nutrition?
Yes, I have seen that. And that's where I tell them, take it, even just today, I told this, I was talking to this patient about it. I was like, now don't go home and purge your whole kitchen, right? It's like one choice at a time. And it's a cumulative effect that will add up over time. And then by making, maybe you choose to do meatless Monday, this week. And then maybe next week you're looking at, eating more quinoa as opposed to white rice, or doing a veggie noodle as opposed to spaghetti noodle, traditional pasta and that sort of thing. And I think kind of making it, so it's like bite-sized pieces that they can take it step by step by step makes it actionable for them and not completely overwhelming where they're like, well, why would I even bother? Why bother trying at all?
I'm speaking today with Dr. Ashley Eskew. We are talking about nutrition and fertility. Dr. Eskew, before I run out of time, I've got one more question for you. You are the chair of the ASRM Nutritional Special Interest Group.
I am. Yes.
Yeah. Can you bring us up to date on some of the goings on with this particular group, or what we should be looking forward to from the group in 2022?
Yeah, I'd be happy to. I actually just found out this week that our proposal for the, pre-Congress course got accepted for 2022 in Anaheim.
Congratulations. Absolutely.
Thank you. So we'll be having a half-day symposium on an evidence-based approach to integrative fertility treatments. And so we have Ali Domar there, who will be a wonderful, wonderful speaker, and then also Audrey Gaskins. So they'll be a part of that group. And then we're actually working on more resources to be able to provide on the ASRM website for physicians to be able to give their patients. Because I found, as a practicing clinician, that's one of the most challenging things is not only having the time to talk about with patients when you have these other complex consultations going on, but also to have the evidence-based resources to point them to. Because, We know there's a lot of misinformation out there on the internet, and our patients are quite savvy with finding, information through Dr. Google. So that's something that will hopefully be getting a little more robust and something to look forward to in 2022.
Is that going to be on the, I'm assuming then on the patient education website? I know currently that we have it. We have two websites. We have the ASRM.org, which is for physicians, and then our patient education one, or as I like to call it, the red one and the blue one.
Yes.
So y'all are looking to post more stuff on the blue one.
Yes, that would be the goal. Mm-hmm. Yeah.
So in case I get any emails from listeners, they're just like, I don't know where this is. I'm like, click on the blue one.
Right.
You will find everything that you need to know. Dr. Eskew, thank you so much for taking time out today to be on the show. It's been an absolute delight speaking with you.
Of course. Thank you so much for having me.
Please rate and subscribe the show on Apple Podcasts, Google, Spotify, or wherever you get your podcast. As always, you can email me questions about the show, asrm@asrm.org. I've only been saying that email for 10 years. Once again, I want to thank my guest, Dr. Ashley Eskew, for being here talking about nutrition and fertility. And until next time, I'm Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, author information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM. ASRM Today series podcasts are supported in part by the ASRM Corporate Member Council.
The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These are provided as a source of general information and are not a substitute for consultation with a physician.